Passage of Proposition 14 going to mean an infusion of $5.5 billion in new funding for stem cell research in California. And joining us is Joe Panetta, President and CEO of Biocom California, which works to build the industry throughout the state. Joe, welcome.
Thank you, Jim. Good to be with you.
So Prop 14 has passed. $5.5 billion is a lot of money. Where are we? What happens now moving forward?
Well, you know, CIRM has a 15-year history of success after the passage of Prop 71 back in 2004. We've got more than 50 candidate products in clinical trials, and this will allow us to continue to move those candidate products through trials, and it will continue to allow us to do funding under our grants program for more research well into the future. And there's about $1.5 billion of that $5.5 billion under Prop 14 that will go to diseases of the brain, diseases like Alzheimer's and Parkinson's that we need to address as the population continues to age here in California.
So you mentioned CIRM, and that's California Institute for Regenerative Medicine, and that's the state agency that handles this big, I want to say, pile of money, $5.5 billion. But how does it work exactly? How do we determine where that money is going to go?
Well, that's a very good question. It's a very thorough process. It's a process that involves a lot of review by many experts under a grants approval program. Companies, research institutes, universities apply for CIRM grant funding. Those applications are then scored by experts on several committees that we have, and the scoring then moves on to the CIRM board for review and approval. So it's a very thorough process, and we take a look at how we feel that money will best be spent to benefit patients in the future.
And what do you think the passage of Prop 14 means for San Diego? How much of that money might come here?
Well, you know, over the years that the $3.5 billion under the original Prop 14 has been in place, about a third of that funding has come here to San Diego. It's gone to organizations like the Scripps Research Institution, to the Salk Institute, to the University of California here at San Diego. And it's gone to companies here, some very important companies like ViaCyte, which is working to develop pancreatic islet cells, the cells that actually produce insulin so that diabetics will be able to have the insulin produced within their own bodies as a result of the work that they're doing. Companies like Samamed is working to treat osteoporosis, bone degradation that again affects us as we grow older. And Vala, which is here in San Diego, developing cardiomyocytes, the cells that can replace heart cells that might be damaged in a heart attack.
So glad that you mentioned the specific things that are being worked on, because we've been talking about the economy, but it's actually the miracles that are taking place in terms of medical research and stem cells that's the exciting part and why we're spending this money.
Absolutely, and it's an investment in the future. You know, if we can treat diseases like diabetes and Alzheimer's and Parkinson's, not only will it bring down the overall cost of healthcare in the future, it will certainly allow those patients to enjoy longer life and better quality of life, allow them to continue to work productively as well. So it'll bring down both the cost of healthcare and it'll contribute to the ability to grow the economy because those folks can be productive.
Joe Panetta, President, CEO of Biocom California. It's such a pleasure to talk to you. Thank you for your time, sir.
Thank you, Jim. It's been a pleasure.